Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. For most patients, an MRI examination is straightforward. You arrive, complete a safety screening, lie still, and the scan is finished. But occasionally, something unexpected happens. A patient becomes anxious. Images need to be repeated, a piece of metal is discovered, or the examination must stop entirely. Today, we're going behind the scenes to explore what happens when an MRI doesn't go exactly as planned, and why every safety step exists to protect both patients and healthcare professionals. Unlike CT or X-ray, MRI doesn't use ionizing radiation. Instead, it uses an extremely powerful magnetic field along with radio frequency energy to create detailed images. That magnetic field is always present in most clinical MRI systems. Because of this, MRI has unique safety considerations. Every patient is carefully screened before entering the scan room. Questions about previous surgeries, implanted medical devices, metal fragments, medications, and other medical conditions help determine whether MRI is appropriate and how the examination can be performed safely. These questions aren't simply paperwork. They're one of the most important parts of the examination. Sometimes a patient remembers important information only moments before the scan begins. Perhaps they had metal removed from an eye years ago. Maybe they recently had surgery and aren't sure what type of implant was used, or perhaps an implanted medical device wasn't mentioned during scheduling. In these situations, the MRI team pauses. Additional information may be needed before deciding whether the examination can safely continue. Sometimes the scan proceeds, sometimes modifications are made, and occasionally another imaging examination may be more appropriate. Stopping to ask questions is never a setback. It's part of keeping patients safe. MRI scanners can feel confined. For some people, lying still inside the scanner can be uncomfortable or even overwhelming. If a patient feels anxious, the examination can often be paused. The MRI team may provide reassurance, explain how much time remains, adjust positioning, or discuss options with the referring healthcare provider. Many patients are able to complete the examination after taking a short break. Communication is one of the most important tools in the MRI department. MRI takes time. Unlike a photograph, many MRI images are created over several seconds or even minutes. If the patient moves during that time, the images may become blurred. Even swallowing, coughing, or normal breathing can affect certain examinations. When this happens, the technologist may repeat part of the scan. Repeating images isn't a mistake. It's a commitment to obtaining diagnostic quality images that allow the radiologist to answer the clinical question accurately. Some MRI examinations use contrast material to provide additional information. Most patients tolerate MRI contrast well. As with any medication, however, unexpected reactions can occasionally occur. If a patient feels unwell, the MRI team follows established protocols to assess the situation and provide appropriate care. Healthcare providers also review medical history and kidney function when indicated before administering certain MRI contrast agents. One of the rarest events in MRI is something called a quench. A quench occurs when the superconducting magnet loses its superconducting state, causing the liquid helium used to keep the magnet extremely cold to rapidly boil off. Modern MRI facilities are designed with specialized venting systems to safely direct helium outside the building. Quenches are extremely uncommon and generally occur only under specific circumstances. Most MRI patients will never encounter one. Even so, MRI departments train regularly for emergency situations so they can respond quickly if one ever occurs. If you've ever wondered why the MRI team asks the same questions more than once, there's a reason. Safety relies on multiple layers of verification: confirming your identity, reviewing implants, checking previous imaging, ensuring the correct examination is being performed. Each step helps reduce the chance of an error. These repeated checks are a sign of a strong safety culture, not inconvenience. MRI safety is a team effort. MRI technologists perform detailed screening and monitor patients throughout the examination. Radiologists help determine whether MRI is appropriate and interpret the images. Medical physicists support quality assurance and safety. Engineers maintain the equipment. Together, they help ensure every examination is performed safely and effectively. Although unexpected situations can occur, they are usually managed calmly, carefully, and according to well-established safety procedures. Every checklist, every screening question, every repeated image, Every conversation with your MRI team has one purpose: providing the safest possible examination while producing the highest quality images for your care. The next time you have an MRI, you'll know that behind every scan is an entire team committed to your safety. Thanks for watching in the No Medical Imaging, where we make medical imaging easy to understand. If you enjoyed this video, please like, subscribe, and share it with someone who would find it helpful. We'll see you in the next one.